Welcome to Safe and Sound, a monthly podcast on cybersecurity, presented by GrandPad and the Leighton Podcast Network.
Welcome into another edition of Safe and Sound on the Leighton Media Podcast Network. We're joined, as we always are, by the CEO and co-founder of GrandPad, Scott Lean. And Scott, welcome in once again. Great to be with you, as always, my friend. Let's talk a little bit because it's been a little while since we created this podcast that we've talked about your background. So give us the elevator pitch, as they like to say, of who you are and what you've done.
Yeah, I've spent my whole career, more than 30 years, trying to figure out how we can use technology to improve people's lives, how we can use a useful tool to make things better. And 10 years ago, we started GrandPad, and it was initiated by my mom, who was in her 80s at the time, and she was struggling and frustrated with technology. And I remember holding up her iPhone at the time, and she said, "This thing makes me feel stupid." And I'm not stupid. My mom was a brilliant lady. She ran her own business, and she said, "Scott, you're the tech guy. Can't you design something for us older people?" And that was really the trigger event. And so my son, who's my co-founder, and two other founders, we started 10 years ago to design something explicitly for this awesome age group called super seniors, those over the age of 75. And we really rethought everything. And instead of us designing it, the super seniors were the designers. We have a group of 10 people, our grand advisors, who really tell us what they want and show us and help us design it. And we just build what they want. And so we've rethought everything from the packaging to the hardware of what GrandPad, it's a tablet-based solution, even to how we answer the phone and support them. Meaning, as an example, we don't have one of those VRUs, press 1 for this, 3 for that. We answer the phone and we help them. So that was the initiation of GrandPad, and 10 years later, we've reached more than 1 million people around the world. But we're really on this quest to reach more than 32 million super seniors in the U.S. who need our help right now. And this topic we're going to talk about today, sadly, scams against seniors, is, again, one of the many reasons why people might need something like GrandPad to help keep them safe.
Moms are pretty wise, aren't they?
They are. Listen to your mom.
We should listen to our moms more. All right, yeah, you kind of teed up part of the conversation here, which is it's Medicare open enrollment season, and one of the things that we know, Scott, is the scammers will tie themselves to whether it's whatever's current at the time. We've talked in our last one about election scams, and they always try and find something that's hot that makes you vulnerable, and this is certainly one of those.
That's right. Yeah, it's been elections. Sadly, we've had some terrible hurricanes. The bad guys will use that, disaster relief. So they'll prey upon, the current urgent issue of the day. And as you said, we're moving into the sign-up period, open enrollment for Medicare, Healthcare.gov, and other healthcare insurance for us of all ages. Usually it's now through the end of the year, sometimes into January. And so the bad guys will use that to call you, to email you, to text you, and say, and they'll have a lot of information about you. And that's the first point is you'll be convinced that it's legit, that it is your insurance provider, that it's the government official, that it's your doctor, because they're going to have so much information about you. It will feel very natural. And they're going to be claiming to help you. It might be helping you find the best deal, and we just need a little bit of information, and then we can give you a quote, and we can lower your insurance rates by some outrageous claim, and that's one of the triggers, right? In our acronym STOP. One of the O is outlandish promises, right? And so the other thing is they'll often pose as a government authority, and we just need to get your Medicaid account number, and we've got to validate this. For example, one person reported being targeted through text messages, and they shared the following. I received a text message saying that my health benefits were about to expire, and I needed to call the number to renew. I called. The representative told me I had to pay, and my bank had to verify them. And that is the next trigger. When all of a sudden you got to get your wallet out. We need money for something, whether it's a credit card number, your banking information, a check, I mean, heck, they'll even do cash. They'll tell you to go to an ATM, transfer, and that should be a trigger that you know it's a scam. And so no matter how good the deal sounds or how convincing the caller seems, don't do it. It's a scam, and as you share personal information, they just use that to build the case.
You know, I want to step back for something that you just said there. We all love social media. When it's used the way it was designed to be used, it's in the name, is it was designed to be social, to share things. Now, it's gone way off the rails. It's not really that. And so in some cases, it's even become a division media between people. But that's where they mine a lot of data, whether you post pictures with your kids and list them by name, or that's where they mine a lot of the data.
It is all sources, but Facebook being the classic example of social media. And here's a really simple example, and sadly, I've seen people continue to do this, where they'll post a picture of them and their whole family at the airport, saying, "So excited to go on this 10-day trip to Paris with my whole family," and they post it on Facebook, and by default, it's public. Anybody can see that. And the bad guys are mining that, and they see, Scott and his whole family are going to be gone for 10 days. Just a few quick Google searches, and they can see Scott Lean lives here. Wow, there's a picture of his house. That looks like a great house. We've got the address. We get a few more little facts here, and now they're breaking into your house. I had a friend that this happened to several years ago. They posted the bad guys came into their house, got into their garage, pulled into their garage with a big van. They went through the whole house. They were there the whole day because they knew everybody's gone. They went through everything. They stole everything of value, loaded up their van, and left. They came home, and this is back in the days before people uploaded all their photos to the cloud. They took all their computers, all their hard drives, everything. This friend of mine, she lost all of her family's digital photos. And it was simply caused by the fact that she had posted unknowingly, like, we're going to be gone on vacation. So that's a real trigger example. But they're mining everything on social media. They're mining public websites. So, of course, there's tax records. You can see who owns what property. Mm-hmm. Who bought a house, who paid what. One of the most recent scams is using Google Maps Street View data. So once you know Scott lives at this address, we can put that into Google Street View. And they do this all automated. And so now we have a picture of the front of Scott's house. And now we can use that. We can send an email to Scott and say, we've hacked into your security camera because we have this picture of your house. And you quickly see that and you go, oh my gosh, they did. And now they've got you on your back heels and you're scrambling because you think somehow they've hacked into your systems.
Yeah, it's interesting you say that because I did hear about that. And when I take a trip now, I've stopped doing that. I live in a very secure building, but I just don't want the risk of knowing that somebody could know I'm not around.
And it stinks because you want to share with your friends, and your friends want to celebrate, like, hey, I'm going to Hawaii or Paris or wherever. And that's one of the key features we built into GrandPad. We call it the private family social network. So you can share with your family, friends, and caregivers, but we call it a walled garden. So the people are invited into that walled garden, and you can share a photo with them, but only those people, might be your 10 or 20 family members or friends, they're the only ones who can see that photo. The bad guys can't get in.
Yeah, and that's so important. All right, let's pivot back. I just wanted to go down that road for a second because I think it's important people to understand how they're getting this data and just some things to watch for. But let's go back to the open enrollment scams and talk a little bit more about some of the things that they're trying to do. And one of the biggest things, Scott, that's been a running theme through all of these that we've done is they prey on urgency. Do it now, do it now, do it now. And I'm sure they're doing that with the open enrollment scam as well.
They absolutely do, because there's a deadline, a cutoff, and so we need information. So usually these scams will start with an email, a text message, or a phone call, and it appears to be a government agency. And these con artists, the scammers, will use a variety of stories. So a recent version that we heard about was the, quote, agent, who was a scammer, requires a customer to answer a survey before receiving their new healthcare card. Or the other one where the scammer says, hey, we need to update your account information. We just need to verify a few things. And they'll kind of lead you on like, okay, Brian, okay, we just need your middle initial, and how do you spell that? And okay, and let's just validate your account number. And they just get you to kind of get out of the rhythm, and all of a sudden you're unknowingly giving them all kinds of information. Another one, these robocalls. So again, it will sound very official, but they're claiming to be part of Healthcare.gov or your insurance marketplace, and it says you must buy this insurance or face a fine. Right, and they're getting you to provide information. The other one is where they're saying you're receiving a notice that your new Medicare cards have microchips that need to be sent out, but we need some information. We've got to verify some things before we send this out. So they'll just come up with all these stories, but the thing is they sound really legit. 90% of us would never even suspect that it's not for real.
And I think that's another one of the common themes I've seen through all of our conversations is these guys are smart. I mean, really smart.
Right. They're really smart. They have infinite information about you at their fingertips, and they're also masters of manipulating, mind manipulation, of convincing you of things. And what's really sad is even in what we do with GrandPad of helping seniors through this or people that have been scammed, even an example of someone that we worked with who did get scammed. They realized they got scammed, and we're talking tens of thousands of dollars. The police were involved. Everything was locked down. 6 months later, they're getting scammed again. And it's just this mental manipulation and convincing them, and sadly, they're brainwashed. They feel that it's totally legitimate, and they're in their mind, they're completely convinced that this is not a scam, and now they're giving the bad guys money again.
And I know so much of what we do is trying to educate people on that, but what do you do with that person that just doesn't want to believe? I mean, they don't want to believe that they've been scammed. What can we do for those people? How can we help them, or what can we do to help that person who just believes?
It's really hard because when people are getting scammed and they're telling their friends or family like, wow, I'm helping this person, and I'm helping them through some bad situation is this particular scam, and their friends and family are telling them, no, Mom, that's a scam. That's not true. It's a bad guy. They're like, no, it is true. And so then sadly a fight ensues. Walls are put up. People stop talking to each other. So, you have to meet people where they are. And, again, in their mind, and in this particular case, this person is completely of sound mind. This is not someone that's suffering from a mental health issue or dementia. They're of sound mind. And so, again, it can happen to people of any age. So you've got to just keep talking about it and not get in a fight about it and keep working to get educated. One technique is often bringing in a third party. The police, I live in a small community, but the police are absolutely fantastic. Sadly, the police in communities of all sizes have had to get really good at this. They're dealing with it all the time. And so they can be a good trusted third party, and sometimes the uniform effect, you bring it in and hey, here's Officer Smith, he's going to talk to Mom about this. He'll ask some questions, do his investigation, and come back and say, look, Mrs. Smith, this is a scam, this is not legit. And sometimes that's kind of the eye-opener. But the best thing really is be proactive and talk about this before something bad happens, right? So it's kind of like, because what the bad guys are doing is it's like magic. It's like a sleight of hand. And like we've all gone to, we've seen magicians and you see them on TV or Las Vegas and you just see the trick and you're like, wow, that's amazing. It's, sleight of hand and you can't figure out how it works. Then you see these videos where they pull the curtain back and they expose how the magic was done. You're like, I can't believe, I was tricked mentally by that. And it's the same way here. If you can dispel the myth before it happens, then people will see it coming and they won't, be able to be brainwashed.
These guys are on a curve of staying ahead too, right? I mean, that's the other problem. That's the other reason why we have to stay vigilant is because they're always constantly, sadly, working on the next scam.
They are. Yep. They move from one thing to the next to the next. And it's that old saying, if 3 people are being chased in the woods by a bear, you don't have to be the fastest person. You just don't want to be the slowest. And that's what the bad guys do. They go for the low-hanging fruit. They go for the easy targets. They're fine to start out nickel-diming people, just getting a little at a time. But again, they do their research, and they know who has money and who doesn't. They can tell public records. They can see, oh, Brian owns this property. He clearly is a person that has some asset. That's part of the reason they target seniors and elderly people. The bulk of the wealth is accumulated with people over the age of 60. They're fishing in the pond where there's some big fish, and then they start to see where do they get a nibble, and then they start going after that. I mean, that's why it's called phishing attacks, right? They're targeting people. There really stinks that we even have to talk about this, and that this is the world we live in, but it is going to continue. We all have to educate ourselves and be savvy about it and keep building up our defenses. And, be involved, be aware. There are new technologies and new legislation, new things that are coming that I feel over time are going to make it better, but this is the world we live in now.
One of the things that I saw recently is the cell companies could actually slow a lot of this down because of the way they're paid, and I don't want to get into a whole bunch of it, but the way it hops, right? And so every time a call comes in and hops, they get a chunk of money. And so as these scammers come in and hop, it's billions of dollars for them. So if they wanted to, and I'm not beating up the cell phone providers for making money, but they could slow some of this down because most of these calls originate overseas.
Sadly, the majority of the emails, phone calls, and text messages are scams, and it creates a lot of traffic. As you said, carriers and other people are making money just on that cell phone traffic, even though it's not legitimate. That's where legislation is being put in place, and there's some new standards. There's a standard where numbers have to be validated end to end. And that, when you see a phone number ringing and it says that it's Scott calling you, you can be certain that it is Scott. Today, it's very easy to spoof. We work with a number of European countries. Europe is much further ahead of us on putting legislation in place. They have a law called GDPR, and that has very stringent rules around this. Also, like in Germany, to get a phone number in Germany, you have to legitimately prove, hey, I'm Scott, here's my address, all that. You can't just buy these throwaway numbers and get burner phones like you can get here. I mean, you and I could walk down to any store, get a burner phone. You can pay cash for it. Nobody knows who owns that phone, what that number is, and now you can start to perpetrate scams using that number. In a number of other countries, that's just not possible. And so, I am a strong advocate of putting more controls in place because we're all suffering because there's not enough legislation, laws, rules, and guidance from the carriers around this.
Are there many of these scammers actually operating in the U.S.?
Yeah, they're everywhere. They are in the U.S., around the world. I will say that some of the most aggressive, organized crime rings around this are in countries that are very economically depressed. There was recently a great CBS News piece, an in-depth piece, where CBS was actually able to go into one of these, boiler room call centers overseas. It was in Ghana and in a very economically depressed area. And they were interviewing the scammers, and these scammers were stealing millions of dollars from mainly seniors in the U.S. And they asked these guys, how can you sleep with yourself? They all had masks on, of course. They didn't expose their identity and whatnot. But they said, look, if we don't do this, first, my family will starve to death. And the crime ring leaders, the bosses, will kill me or family members. So it's, they're being essentially held hostage. And they're in an extremely desperate situation. Doesn't make it right, but it just shows you what's going on.
And they're not even the ones on the front end of this thing developing these scams. It's the crime lords, and they have to execute.
That's
and
right.
I'm sure it's a boiler room type situation where they're forced to make a certain amount of calls. I'm sure they have quotas and all that stuff. And you're right. I've seen some interviews like the one with CBS where they talk to some of these guys, and they basically have said it's the only way. I heard him talk to one that was using that money to go to college just to try and improve himself. And he said, I can't find a job that will pay me to go to college like this one does. And it is. They prey on these economic issues in these third world countries, and it's slave labor.
Sadly it is. And that's the other thing. Then you say, well, why doesn't the U.S., why can't we go prosecute these people? And the whole system is corrupt there. So, you try to go after and arrest it, even if they're brought to trial, the judge is bribed and they let them off, right? So it's very, very difficult to prosecute. They can't be extradited out, so that it continues. And I think it just shows, we're all connected worldwide and all boats rise together here. And so as long as there's these really economically depressed countries or places around the world, that's where the bad guys are going to thrive, and they're going to resort to these kind of crime rings.
It's amazing. I mean, the world has shrunk so much, and that's in some cases a good thing, but it's really become in many cases a bad thing as well. Let's wrap up, Scott, by circling back on the Medicare and the open enrollment, and just reminding people again of what to be wary of.
Again, during the sign-up period, be careful, be wary of anyone who contacts you out of the blue. I mean, you know who your health insurance providers are. You've been down this road before. All of a sudden, you're getting calls out of the blue. They're offering you free gifts, and they're doing this extra screening. Be very, very leery of that. Again, hang up, call back, call the number that is on file that's the right number. Go directly to official websites. If you're working through your employer, contact your employer, your HR, your benefits company, work through them and find out the proper numbers. So I think the other thing is, you can go directly to the Medicare websites, and if you have issues around this, you can call 1-800-MEDICARE or go to Healthcare.gov and research what's actually going on with the signups.
I think another thing too, back in the day, we thought nothing of sharing our Social Security number. I wouldn't do that today for anything. So as we talked in prep for this, one of the things that I definitely jumped out at me that you and I talked about is guard those government issued numbers. Just don't share them. Don't offer your Medicare ID. Don't offer your Social Security number. If they're asking for that stuff, they're not official. If they're calling you, they know that information.
That's right. And sometimes, I've had businesses ask for it, like they're just like, they're a legit business, but they're asking because they use it to document something, but they really don't need it. I refuse to give it. 90% of the time they say, oh, well, that's okay. We don't really need it anyway. So yeah, I'm very protective. Now, that said, sadly, there's been so many cyber attacks and breaches. The bad guys have much of that information already. We've talked previously, there was a massive cyber breach last spring of a big health insurance provider in this country. Estimates are more than a third of the U.S. population's health information, like they're not just social and phone number and all that, but their specific diseases, conditions, like all their health records has been compromised. So that's where the bad guys will have a lot of information. Like they call and say, oh, Brian, we saw that you visited the doctor and you have this condition. Like they'll know very specific things. And that's where you just hang up, you call your doctor back at the number is legit, or even better, go face-to-face whenever you can.
I'm old enough to remember when my driver's license number was my Social Security number.
Right.
So that gives you an idea just how old this guy sitting on this side of the table is. I think, Scott, the other, I want to wrap it up kind of the way we always wrap it up. And that is just remind people one more time, put it to the smell test. If it doesn't smell right, just stop.
That's right. Yeah, the key again is awareness and communication. Again, this issue is not going away. It's the world we live in. We should all be talking about it with the seniors, mom, dad, grandma, grandpa, in our families. Educate ourselves. Do your research. Remember our little acronym STOP, S-T-O-P. S is suspicious context. T is threats or urgency. O is outlandish promises. And the real trigger, the P, is payment requests. When somebody starts asking for money, and again, it may start as $1, but that's where they just get you to open your wallet, and then it keeps escalating up from there. Be careful, be educated, and you can always contact us, GrandPad. We're always happy to help, whether you're a customer or not a customer. We're happy to assist and provide educational resources on this.
Absolutely. It's grandpad.net or 888-904-4723. And it's one of the things that one of many things that I admire about Scott and Scott's company is they're about safety. If you're a customer, great. They'd love to have you. If you're not and you just need help and you're concerned or you're worried, 888-904-4723. It'll be answered by someone in the United States 24/7, and they're willing to help you. So I appreciate that, Scott, very much.
Yeah, great to be with you, Brian.
All right, as always, we look forward to next month when we'll talk to Scott again on Safe and Sound on the Latent Media Podcast Network.
Safe and Sound is a monthly podcast presented by GrandPad and the Latent Podcast Network. Find this and other podcasts on demand at WinonaRadio.com.